I want to explain a few things about physical therapy with regards to low back pain. There's really 4 stages that we're looking at. One is the acute stage, where you first hurt your back. Second is subacute, that's a little later, a few weeks later. We have a third group, which is a recurrent low back pain. That cycles, you get over it, but it comes back every 6 months, every year, etc., whatever it is. Then the fourth one is chronic. So the most important thing for all practitioners across the board, research-based, is to stop a patient sliding down this scale. The longer you have the pain, the further you slide down towards chronic, which is over 12 weeks of pain, the harder it is to get you well and get you out of pain. If we see you here when you're acute, the chances of you going down the scale are a lot less, many times less. So early intervention with conservative care is critical, and it's backed up by research. Now the reoccurrent low back patient is very interesting because we do get people better, but then it comes back, maybe 6 months, maybe a year. But the point was what we did worked. So this is not such a big problem as long as we can figure out what's reoccurring. But patients often think, I tried that, it didn't work. But actually that's illogical. It did work, you recovered, you went back to what you were doing, it just reoccurred later. So we need to pay very careful attention. If you have reoccurring low back pain, that's something we need to look at very carefully and find out what are you doing that makes this reoccur. Once you get the chronic, it's much more difficult. We can help you, but it's more difficult when you have chronic pain. As you slide down this scale, we will also see brain changes. As pain becomes chronic, we see changes in the brain too. So the way you feel pain and how pain affects your life is also a lot harder at this stage. So early intervention is the key.